Healthcare today finds itself at a crossroads. The future direction is unclear. Healthcare reform remains on the horizon, but details are still to be determined. The general consensus is that reimbursements will decline. Hospitals and healthcare providers will be scrutinized more than ever. And quality will continue to play an important role in consumer confidence. 3 North Carolinians are being honored for their leadership in ensuring quality in their organizations or around the state.
Bland is somebody who deeply understands the notion of process improvement in complex organizations, and he's brought that to bear especially in healthcare, as we in hospitals and healthcare institutions are trying to look intently with a systems approach to improve what we do to benefit the lives of the patients we serve.
You sometimes run across people in voluntary positions that they kind of cede some of their responsibility to management or for others to handle. Jim takes this job very seriously.
He is a very caring person. It's clear that he is quite an expert in his field and pulmonary medicine. But also he's sensitive to so many of the things that are going on in healthcare now.
The North Carolina Hospital Association is proud to honor these 3 individuals. A statistician who simply believed there was a better way of providing health care. A dedicated citizen who helped his organization grow into the largest healthcare system in North Carolina. And a physician whose leadership has helped educate policymakers about the important role that hospitals play in our communities. All 3 have significantly impacted healthcare in North Carolina. Dr. Blanton Godfrey of NC State University is the 2011 recipient of the NCHA Meritorious Service Award. Dr. Bland Godfrey is not a medical doctor. He does not work in healthcare. Yet he has had a very important impact on healthcare in our country. Dr. Godfrey is a statistician and professor who studies how systems within organizations work and how to make them better. A few years ago, he met Dr. Don Berwick, who is now the administrator of the Centers for Medicare and Medicaid Services.
Life seems to turn often on moments of serendipity, lucky times almost by accident that change your whole future. For me, meeting Bland Godfrey was such a moment.
Berwick was trying to improve quality at his health maintenance organization. Godfrey was in charge of quality systems at Bell Labs. They met, and Berwick learned that most major companies have sophisticated ways of studying processes and measuring quality improvement.
I was so surprised that healthcare wasn't doing these things. I mean, they were the things that there were hundreds of books and articles, there were journals. This was a methodology, technology that, most of us just assumed, because we lived it every day, was used everywhere.
It was an amazing day for me, one of the turning points in my whole understanding of the approach to quality. But even better than that, I began to know Bland Godfrey as a teacher and then a friend.
Later, Godfrey and Berwick organized meetings between leaders of healthcare organizations and quality improvement experts from private industries. Soon, they developed the National Demonstration Project on Quality Improvement in Healthcare.
Out of that project grew a book, a friendship, a whole cadre of quality scholars not in healthcare who became involved in healthcare, and a whole group of healthcare leaders who became more familiar instantly with the idea that there were scientific foundations for the improvement of healthcare.
Other demonstration projects followed, including one known as the 100,000 Lives campaign. Hospitals signed on to follow proven methods of quality improvement with the goal to save lives through the elimination of complications and error.
It's just a simple exercise. If we got this many, and they did this, and they got the same results other hospitals had gotten, the difference would be 100,000 people alive who wouldn't be alive.
It worked. Estimates are 128,000 lives were saved, and healthcare was changed forever.
Unfortunately, we had viewed healthcare as a cottage industry where each person, each doctor or hospital or nurse or whatever did what they did as a professional, and we urged them to do the best that they could, but we didn't take a systems approach, and that is the landmark contribution of Berwick and Godfrey, is to say these are complex systems, and we can use the tools of process engineering to dramatically improve what we do.
Today, Bland Godfrey is the Dean of the School of Textiles at NC State University, but he still advises healthcare organizations on improvement. And while he's proud of what has been accomplished, he feels there is more to be done in our hospitals.
It really has to be a much wider spread in the organization than it is now. And I mean from the board to the senior management team, to pharmacy, to radiology, to the path labs, to every. It's a very complex system, but we have to work it as a system. We can't fix things a little part at a time. We have to think across the entire hospital, but we have to think before the hospital and after the hospital.
Oh, he's changed healthcare in America in fundamental ways that will continue to improve healthcare. It's not a one-time thing.
I don't have a friend or colleague who's been more valuable to me than Bland Godfrey has in helping me learn, adopt, and use the best thinking possible in the world of improvement, and giving me a great model of friendship and leadership for change. Thank you, Bland, for everything you've done for me, and congratulations on this very well-deserved honor.
Jim Hynes, chairman of the Board of Commissioners at Carolina's healthcare system, is this year's recipient of the NCHA Trustee Merit Award. Jim Hynes has been chair of the Board of Commissioners at Carolina's healthcare system during a period of dramatic growth for that organization. Now the largest healthcare organization in the state and one of the largest public systems in the country, Hynes chairs a board made up of some of the Charlotte area's most influential citizens.
First of all, we live in a great community, but most importantly, I'd say we have a very strong board that's very interested in the institution. And the number one thing we've tried to do is have top management, very talented management, and be innovative and creative and stay ahead of the curve.
I would say that Jim's biggest accomplishment since chairing the board is the building out of the board, both structurally and in terms of the membership of the board. And Jim takes very seriously his role in ensuring that on the day he walks out as chairman, he's leaving behind a solid organization and with a solid board.
One of those who served on the board with Jim Hynes is North Carolina businessman and former White House Chief of Staff, Erskine.
I got a chance to see him really lead and get a chance to see, how you get things done working with people who are volunteers. And I got to see a guy who knew how to motivate people to do, including me, to do a lot more than they really wanted to do.
Many of his friends believe Jim Hynes learned his leadership skills as an officer in the U.S. Navy, including time spent on an admiral's staff.
When you're 22 years old and you're managing people that are 40 years old that know more than you know, it's not unlike being chairman of the board of a hospital system and trying to work with physicians and managers that know more than you know.
Charlotte businessman Smoky Bissell is one of many who knows that Hynes is a master at recruiting community leaders.
Generally, if Jim calls you to come see you, you're not going to make any money on that call.
A retired successful businessman himself, Hynes is fully engaged in his role as chairman of the board at Carolina's Healthcare.
You sometimes run across people in voluntary positions that they kind of cede some of their responsibility to management or for others to handle. Jim takes this job very seriously. I have never seen anybody as committed to a voluntary role like this as Jim Hynes. He plans his life around this organization. He loves this organization, and it shows.
Perhaps one reason Hynes is so successful at leading Carolina's Healthcare's board and recruiting community leaders is his commitment to the organization's mission of treating all who enter its doors regardless of their ability to pay.
The plain truth is this hospital has always had the tradition of taking care of everyone, and that was what was so appealing to me. There was a chance for me to serve the underserved people in our community.
He wanted to be involved with the hospital that really took care of all the people of this community. Jim's always been concerned not so much about making my life better, but making life better for people who really didn't have as much.
Bill Fulkerson, Executive Vice President, Duke University Health System, is this year's recipient of the NCHA Distinguished Service Award. Bill Fulkerson came to Duke University Medical Center in 1983 as a physician, a teacher, and a researcher. But he later realized he could make a significant contribution in healthcare administration as well.
Began to realize that as important to me then and today as that individual doctor-patient interaction is, I felt being involved in the leadership of the health system really gave me a chance to leverage what I know. I know how to take care of patients.
Soon, Dr. Fulkerson learned of the NCHA.
Well, I probably first heard or learned about the Hospital Association a little over 10 years ago, believe it or not. Before that, I didn't have any involvement. It was about the time I started working more in a leadership position here at the Duke Health System. And I was introduced to the Hospital Association really through Bill Pulley, who I had known for years before, and really came to learn what a tremendously effective and important organization it was to healthcare providers in the state of North Carolina, not only as an advocate for the hospitals and health systems and providers, but probably more important as an advocate for patients in North Carolina.
Dr. Fulkerson's first leadership position within NCHA was service on the Policy Development Committee, where he helped develop proposals that were taken to the legislature.
Bill has been so valuable in helping the Hospital Association formulate policy, but not just policy as to how you deal with legislators, but quality delivery of health care across the state.
I think the Policy Development Committee experience was terrific. It was at that level where we really heard the nuts and bolts of the issues and were able to formulate policy suggestions or policy recommendations to the full NCHA board. So it gave me, again, a chance to understand things that were very important to hospitals that I didn't know or hadn't experienced outside of the issues that were pertinent to Duke Health System.
Later, Dr. Fulkerson found himself in the unique position of serving 2 terms as chair of the Board of Trustees of the NCHA. He used that opportunity to push for a focus on quality.
Well, certainly his role in leading the North Carolina Hospital Association has provided a statewide platform for Bill's work, but he's also set an example for how hospitals can be players in improving the health of the community.
We've come a long way in the past 10 years in transparency of quality in hospitals, where we have publicly reported information out there that patients, families, payers can look at to see how we're performing in certain categories. But at the same time, we need to do more.
Known for a quick wit and great sense of humor, those who know him well say he is an excellent leader.
Well, I would want you to not be fooled by that self-effacing manner that he has. He has a lot of humility, but so he's not going to brag about himself. But he is enormously accomplished and intelligent, and North Carolina is a better place because of the role that he has played in actively engaging in leadership and in making a difference.
He is a very caring person. It's clear that he is quite an expert in his field in pulmonary medicine. But also he's sensitive to so many of the things that are going on in healthcare now. If I had a few words to describe him, I'd say first, exceptionally bright, exceptionally caring, and exceptionally perceptive.
Being a member of the leadership of NCHA has probably been one of the most important things to me in the past decade of professional development and of effectiveness at change in the state, in the hospitals broadly across the state, and with the policymakers in Raleigh as well.
Dr. Blanton Godfrey, Jim Hynes, and Dr. Bill Fulkerson. All 3 have significantly improved healthcare in our state. The NCHA salutes them for their leadership and dedication to improving the health of all North Carolinians.